As far as with at-home instructions, one important thing is to stress to the owner the importance of cleaning these teeth. A lot of times dentals are not the cheapest thing, and usually an owner realizes that after their animal has been sedated for a dental. So a lot of times they're really on board with trying to keep the teeth clean. They never have to sedate their animal for one, or to not have to pay that kind of money again. So here is let's see which model's better. Here is a model here with, I'm just going to show you the upper quadrant of a dog. There are different ways to brush teeth. There is a finger brush people can use. There is a toothbrush, and this toothbrush is kind of neat because it's made for small dogs and large dogs, or however that animal is better with. People can even use little gauze pieces if they would like. It's not as good as a brush, but it's better than nothing. That's usually what our doctors say, is at least somewhat brushing them is better than doing nothing at all. They can also use like a washcloth, something that has some texture to it that's going to help break off everything. So as far as there are toothpastes out there available for dogs. So as far as one thing we just really stress is even starting out small, working your way up as the animal gets used to everything. So one thing you would do is you would put your finger in the side of the animal's mouth and just kind of gently brushing around, like running your finger all around that tooth as much as an owner can. Just really trying to get above, or like right on the gum line. That's where most plaque and tartar is going to build up. So that is the most important, is to try to get all of that to stay off of that gum line where that likes to build up. And then as far as, so they can do gauze, they can do a toothbrush if they would like, just getting in there and brushing along the gum line there, putting toothpaste on it, maybe doing toothpaste after they're done. We do have toothpaste that has like enzymes in it, so it's good to help try to keep that plaque and kill all that bacteria off of their teeth. And then, so just really, I mean, we tell an owner, just clean as good as they can. Once a day is ideal. Once a week is doable. So as far as the more they do it, the more it's going to guarantee that that animal does not have to come in for a dental ever again. Or at least not getting teeth extracted. So as far as, you just put your hand in there and just rub along the gum line really well, trying to get all that plaque and tartar from building up on there. I mean, rubbing the whole surface of the teeth. I mean, it's harder to get inside of the mouth. In my opinion, it'd take a very special dog to get up the inside of the mouth, just because dogs don't like to hold their mouth open too much like that, especially with someone's fingers in them. So just really, I mean, going along the incisors here at the front, making sure like little pieces of hair get out of in between the teeth. Those sometimes build up and can cause more plaque and tartar. Just things like that, and trying to keep infection, and trying to keep these teeth as clean as possible, as long as possible. As far as a dental record, here is what we use in our chart. This particular animal has never had a dental, so nothing is written in this chart. Now, as far as sometimes a doctor does write in this chart without having a dental, let's say if this particular animal didn't have all of her adult teeth. And so what they do in that case is they put a circle around the teeth. That way that they know that that animal did not have that particular tooth in their mouth. Now, as far as during a dental procedure, they are going to check all of these teeth. The maxilla is the upper portion, the mandible is the bottom portion. So what they're going to do is, if let's say they remove a tooth if they remove a tooth, they're going to put an X on, let's say this molar is going to be removed. So they're going to put an X on that tooth, indicating that it was removed during a dental procedure. We also write our dentals up here. That way we know that it was indeed, there's an X on that because it was a dental procedure. So it has every single tooth on here. You've got your incisors, you've got your canine teeth, your premolars, and then your molars are back there. So as far as anything different, now as far as there are lots of different formulas for to record the teeth. So let's say if if an animal has an abscess, if let's say that canine tooth, or let's say a molar is abscess, because I feel like we see that a lot more with the molars than the canine teeth, but maybe not. But anyway, so an abscess tooth, we're going to say that that molar has an abscess. So what we're going to do is going to indicate an A above that molar, right around there. And that indicates for later on down the road, let's say maybe an owner just wants to be refreshed on what exactly happened to that tooth, then we can tell them there was an abscess in that tooth, that's why it was removed. So but there are different ways to record what is going on with that tooth. So as far as this is kind of like a cheat sheet on what could be going wrong with the tooth. So if there's a periodontal pocket on that tooth, well then we're going to indicate a P on that diagram. There could be maybe after cleaning the teeth there's some staining there that we weren't able to get off. Well, then we're going to indicate that there was some staining still there, and that way that's going to help with the owner too. If maybe they get their dog and it's like, hey, these teeth aren't pearly white like she thought they would have been. Well, for some reason there's some staining that is just not able to get off. Gingivitis, if there's gingivitis on the teeth, we're going to indicate that. We can also indicate some of these things whenever they are not under a dental procedure. We could indicate this during just a physical exam, stating maybe why they need a dental and that sort of thing. As far as I'm going to indicate the different teeth on a dog model. So as far as back here, you have your molars that are there. These are considered your premolars. Your canine tooth, which this particular model is missing that canine tooth, but the canine tooth, actually here I'll show you on this side, it is the longer, that's kind of just the longer teeth that stick out that are kind of like your biting teeth. As far as here are some incisors on this particular model, and same at the bottom. You've got your molars down here at the bottom, got your premolars here, and then you've got your canine tooth that is missing on this one, and then your incisors. So those are the different types of teeth on a dog model. Okay, as far as another important thing is knowing how to discuss the dental formula that is required in veterinary dentistry. So as far as here, I have the dental formula chart. We have the dog formula. So I indicates incisor, C indicates canine teeth, P indicates premolar, and then M indicates molar. So, and also they do have it like I 3 of 3. Well, that's going to indicate, I'll show it on this model, it's easier. It's going to indicate as far as which tooth you are talking about. So we've got 2 molars, or like 3 molars there, so it's going to be molar 2 of 3. Maybe is an issue. Premolars, you've got 3 of 3, because we've got 3 premolars there. in this model, like as far as the canine tooth, so canine is always indicated 1 of 1 because there's only one canine tooth on each side, and then your incisors is 3 of 3 as well. So this is just indicating like one basic side of the mouth. It's not indicating the whole side. So that is how we would document things, as far as kind of maybe not by numbering the teeth, but it's going to just help break the teeth down to better know what you're talking about later down the road. One more thing I will indicate on that subject is as far as you've got your primary teeth and your permanent teeth. So your primary teeth is going to indicate puppy teeth, and puppy teeth usually they have about 28 teeth, and then permanent teeth, that is when the animal is full grown and adult, and they are going to have 42 teeth in all. So that is the dental formula that the veterinary dentistry goes by for naming dogs' teeth. As far as here is the cat formula chart. You've got your primary teeth, which is your kitten teeth, and then the permanent teeth. So as like with the dog, the incisors is indicated with an I. So there are 3 incisors on a cat. Canine teeth is indicated with a C, and there's 1 of 1. And then P is indicated for premolar, and there are this one indicates 3 of 2, so that's pinpointing a tooth. And then as far as same with your permanent teeth, I is for incisor, C is for canine tooth, P is for premolar, M is for molars. So as far as that is just indicating another way to indicate which tooth is which that a doctor is talking about. As far as oral nasal fistulas, here is a few oral nasal fistulas as far as they can acquire on the soft palate, but most commonly we see them kind of on the side like that, and it does indicate ways of fixing them. Could be caused by a canine tooth getting removed, things like that. As far as the reason they have showed up is kind of, or most commonly it is between the nasal and oral cavity caused by trauma or disease. As far as the most common is after a dental extraction, these can show up. The way to make sure that these don't happen is to make a very well designed mucosal flap. That is going to help to really seal up the hole to where that hole cannot develop later on. Really bad periodontal disease causes these type of oronasal fistulas as well. Calculus is when a big kind of concrete portion really builds up onto the tooth. Over time, the teeth are going to build up tartar and bacteria, and as that tooth has maybe not been cleaned, that sort of thing, it's just going to keep building up, building up, building up. That calculus can build up and get so thick that it acts as concrete, we always say, but then it's like it'll just pop off of there sometimes, if you're lucky. Sometimes it takes a big dental cleaning and using the forceps to really break that off of there.
We have a chart, please. Thank you.
That is what calculus is. As far as periodontal disease, there are different forms of periodontal disease. That is where there can be a lot of gingivitis created there. So here is like gingivitis. That is where there is a line above the tooth there, and that can be, a lot of times we see that redder than what that is showing. There can be gingival hyperplasia that can show up on those teeth. There can be gum recession that happens with those teeth, where the teeth are just so bad that the gum, it's like it's trying to get away from the tooth because it knows that bacteria and that tartar is bad, so it wants to get away from that tooth. And in turn, it kind of hurts the teeth in the long run. So there are different sizes. We have a 1 to 4 grading scale that we use. So I would say that is a grading of 4, but then 1 would be it isn't as bad. As far as, here are a few different types of fractured teeth. So as far as, here is a crown fracture. So the necrotic pulp is exposed there. So you can see it's kind of right at the gum line there, which, so it's like this animal probably needs some x-rays to determine if that goes below the gum line. Probably going to have to take that tooth out. Here is a canine tooth that has pulp exposure because of the type of fracture that was. So that is, the nerve is exposed, and that tooth needs to be filled because that is both of these are very painful. As far as there are, they can get slab fractures in their molars, and that's kind of where there's just like this hint of crack right in the molar, and sometimes you can't even see until you do a radiograph of that tooth to determine that. As far as worn teeth, things that can cause the teeth to be worn down are, is a lot of times if the incisors are really worn down, maybe that animal has very bad allergies, has had fleas for a long time, because they will wear down those teeth just chewing on themselves. The canine teeth can be worn down over time just from chewing on bones. Sometimes they're cage chewers. And a lot of times if they're cage chewers, it's kind of interesting because you will see that there's silver on those teeth too, and that's another indication that they've been in a cage chewing. They can wear down their molars in the back if they are very aggressive chewers on bones and things that just don't give, which we don't normally recommend those kind of bones like that, like as far as your meat bones, your what is it, like they have antlers out there for animals to chew on, they have hooves, things like that. Those things do not give and can ruin the teeth in the long run, as well as cause fractures too. Also, your retained deciduous teeth. So that is when a puppy or kitten holds on to their baby canine teeth. So they're mainly their canine teeth anyways. That's the most popular one. So as far as when the adult tooth is coming down, sometimes that baby tooth should fall out. Sometimes it does not fall out. And the way you know that is a problem is if that adult tooth has came completely down and that baby tooth is still there, sometimes there's no wiggle room whatsoever. And those need to be pulled, otherwise that can disrupt that adult tooth. It can add tartar to that tooth. It's not as healthy for the animal, so that tooth does need to be pulled. As far as sometimes the incisors can stick in there too, that's not as common. A lot of times they do lose those incisors, but it's more the canine teeth that they will hold on to those, so the retained deciduous teeth for cats and dogs. As far as a tooth root abscess, that is something when bacteria enters the exposed root canal of the tooth. This can happen from the dog chewing on a bone, ice cubes, cow hooves, those hard things that we do not recommend an animal chewing on. So a root tooth abscess, depending on what tooth it is, depends on the severity of what signs it's going to show. So let's say if the tooth root abscess is on a canine tooth. A lot of times what we see with a canine tooth is we see some swelling of the, like right below the eye there, the whole side of the face can be swollen. The whole side of the face can even be swollen from a molar or a premolar as well. But as far as there is a lot of swelling with that, we have seen it so bad that there's been a hole right underneath the eye from the canine tooth being so. Usually animals had that abscess for a while. As far as those are tooth root abscesses, and they that is considered a root canal portion. So that whole tooth we will pull out of that animal, and that's where you're going to more those very deep teeth. That's where you're going to run into the oronasal fistulas, and so we have to make sure that we make a very good flap to seal up that hole that will have developed from removing that tooth.